Welcome back to Basic Concepts of Nursing Care. This is Tracy again, and this is going to be a brief voiceover that is going to concern insufficient information interventions. And when we talk about insufficient information, what we're specifically looking at is our patients and what are our patients lacking. So we want to ensure that our patients have enough information about the surgical experience and surgical procedures, the preparation, so that we can help alleviate anxiety that is related to the fear of the unknown. Maybe could be pain, might be surgical outcomes. So what we'd like to do is ensure that our patients are ready for the surgery. So with informed consent, the surgeon obtains signed consent before sedation or surgery. And truly, it is the physician's responsibility to explain the procedure or operation in its entirety and ensure the patient doesn't have any questions. If the patient continues to have questions, then we need to refer that patient to the surgeon or call the surgeon and say, hey, Mrs. Smith is still questioning why we're doing this, doesn't have clear understanding. I need you to come and visit with her. Our job as a nurse is to re-instruct, clarify, get an idea of the patient's understanding, I guess, and make sure that the patient does have adequate understanding. So by doing that, we want the patient to tell us in their own words the purpose and expected results of the surgery. We have to make sure the patient has been NPO, so nothing by mouth, including smoking. And we'll talk a little bit about when we talk about NPO after in a few slides. We want to ensure that they've carried out the skin preparations at home, because oftentimes we will do a shave or clipper prep and scrub them when they come to the hospital, but also the night before, patients are required to do the skin prep as well. When we talk about informed consent, surgery or anything invasive will require informed consent. So with that, the Joint Commission has stated that patients deserve the right to be informed. They deserve the right to be involved in their care, and they deserve to have an understanding. So when we say those things, that means that the nature and reason for the surgery, they need to know who's performing the surgery and who else will be present. So when we talk about the intraoperative and you see all of those people involved, all of those people are going to be important to talk to the patient about. They need to know any other options. They need to know what their risks are. What are the outcomes or potential outcomes? And then they also need to be notified of the risk of using anesthesia. And by obtaining informed consent, it's a #1 way for patients to help ensure, or for us to ensure patient safety. It also will help us so that we don't perform the wrong procedures. If we don't perform the wrong procedures, we're not set up for lawsuits because we won't be doing surgeries that aren't authorized by our patients. As you can see on this slide, patients may sign with an X. If you have a patient that can't write their own name and they need to sign it as an X, you need to have 2 nurses witnessing that. In an emergency, you can do telephone authorization, and again, it's going to be requiring 2 nurses to authorize that. So I would get on the phone and I would say, Mr. Smith, this is Tracy Hansen. I'm a registered nurse at Lakes Regional Hospital, and I am calling because Mrs. Smith needs to have a hip replacement done immediately. Say we've already given her morphine. Maybe she's a confused, demented Alzheimer's patient. After he tells me yes, it's okay, then another nurse would get on the phone and I would say, hello, my name is Sue and I'm calling to obtain consent as well. And so then 2 people have told that person on the other end of the phone exactly what we're going to be doing, and we have both heard that it is okay to carry out the procedure. Then once that person who has authorized consent via telephone if they come to the hospital, we would ask them to then sign that consent that we have both done a phone consent for. Special permits may be required for some procedures, so like sterilization. If a woman would decide to have a tubal ligation or a gentleman have a vasectomy, there is a special form they need to sign that states they understand that they will no longer be able to have children. Experimental procedures are also going to require a special permit. There is typically a separate consent for anesthesia as well as blood products. Under an emergency situation, say you have a trauma victim that needs to have surgery right now, and you've made every effort, every attempt to notify their family, and you've not been able to do so, 2 physicians can sign a consent as long as they don't have anything to do with the surgery. They haven't had contact, they're not really associated with the case. Blind patients can sign their own consents. It's going to again require 2 witnesses. People that have English as a second language or don't speak the general language of whatever facility you're working in, oftentimes they have language lines, maybe interpreters, but if that's not accessible, it will require a second witness if you don't have a translator. And then your hearing impaired, if you have someone that can communicate with that person that's hearing impaired, that's going to be your best case scenario, is to have someone be able to interpret the information that you're saying to them. So someone that does sign language or something would be a really good person for them. And then again, 2 witnesses to sign that consent. As far as the national patient safety goals regarding informed consent, our purpose is to obtain that consent saying yes, it's okay to perform stated procedure on the patient. We also want to ensure the correct site is being selected, that we don't do surgery on the wrong site. So if you have a patient that needs a left total knee, we definitely don't want to go in and do a right total knee on them. And before these initiatives took stand, there were more incidences of patients being operated on wrong limbs, wrong areas. And so this National Patient Safety Goals that was formed by the Joint Commission has really cracked down on those things from happening. And so what will happen is that we would really like to see the patient sign that operative site and then follow that up with the surgeon or practitioner signing the site as well. And then when our patient gets into the surgical suite, before starting that operative procedure, the facilities will use an official quote-unquote timeout, which you'll see is listed number 3 on this slide. With that official timeout, it's typically the circulating nurse in the operating room that will stop the procedure. So if it was myself going in, the nurse would say, I would like to call the official timeout. This is our patient, Tracy Hansen, and she is here today to have a right total hip replacement. And I would still be awake, and I could say yes, no, and then you would look at that site to verify the correct site. And then everyone that's in the room, your practitioner provider, the nurse anesthetist or anesthesiologist, the scrub tech or scrub nurse, and the circulating room nurse. And then everyone would have to be in agreement that yes, that's exactly what we're doing. And that's again part of the safety measures to keep our patients safe. So I think that will sum up informed consent. Again, if you have questions, please let me know, and we'll discuss this a little bit more in class.